This is the sixth webinar of our season 1. We want to extend our thanks and appreciation to all the members who have been supporting us and attending all of the webinars. Please make sure that you follow B.I.G Consulting's LinkedIn and you subscribe to our YouTube video. You can also visit our website for the additional information if you require about any of the product. And of course, you can watch all of these amazing webinars that you have attended on our YouTube channel. So far, we have had great sessions with various companies. Initially, we focused on traceability and tracking system. We started with LayerJot from US. We continued with the Atmos group from Finland for identifying, sorting, and tracking of instruments. Later, we introduced Hanjo. Hanjo is the platinum sponsor of WFHSS in Hong Kong, and they brought their tracking solution for the CSST, and we had a very exciting webinar. 2 weeks ago, we had the pleasure of having Ultrazonic CEO, Miss Nancy, with us, and she explained the importance of ultrasonic cleaning and really the hidden secrets of ultrasonic cleaning and what you see in the market and what you have to really pay attention when you are planning to design your CSSD. Today, we are very, very pleased to have Nancy again with us with another exciting product. The title of the webinar is Revolutionary and Unmistakably Endoscopy Cleaning. I will not give you a lot of explanation here. I'm sure Nancy will do that for all of us, but I'm very, very excited about today's presentation. I'm sure we will all learn a lot. Endoscope is a very, very complex field, and I'm sure many of you have questions, and we would like to have it as an interactive session. Again, we are blessed by your presence from guys, can you still see my screen or it is stopped?
For me, it stopped, but I'm trying to share it again. But as you remember, the Teams is for me a little bit difficult with my Apple computer.
I will share from my side, Nancy. Don't worry.
Perfect.
About that.
Yeah,
yes.
But I don't see your screen anymore.
It's okay. I'll do it again. I don't know why it stopped.
Hello, Sir Babak. Good afternoon.
Hello, Dr. Ahmed. How are you?
I am fine. I just want to welcome Nancy. Nancy, she's doing great in Middle East for reprocessing endoscopy practice, and that's really big appreciation by most of our colleagues here in Middle East. And thanks a lot for really this, because I receive excellent feedback about all the session that you are presenting here.
Thank you.
And thanks to all your partners from outside. And this is really, informative presentation since we started from the first till today, the end. And it will not be the end for sure. We will continue to other topics.
Absolutely.
Yes, and we wish in the future, because this is all the request from most of the colleagues, not only in Saudi Arabia, many countries, that if possible in future to be physical event by your company and with your partners, that will be very great.
Yes, that's a great idea. We are thinking about that. We are very excited with the support we are receiving from you and the members, and we should be able to organize some physical training around the conferences and the congresses that you are also organizing in the region. We are thinking about that. Of course, there is a lot about the time, the cost, and bringing all the people under one roof. It is challenging, but we are thinking about that. As you mentioned about Nancy, we are very, very happy to have Nancy based actually in the Middle East. She's an expert in the area of ultrasonic and endoscopy cleaning. in the region. We are very blessed to have her, and we really have to take advantage and cherish her knowledge and make sure that we apply it. Today, we have more than 70 people have registered for the webinar, many CSST technicians, supervisors, and product managers. We have Oman, Sultanate of Oman leading the pack and leading the groups, but we have also wonderful people joining us from Senegal, South Africa, Saudi Arabia, Pakistan, Mauritius, Rwanda, and we are very happy about that, and as well as Jordan. Please make sure to have your microphones muted. Only when you have a question, you can open your mic or type it in the chat, or even open your camera. Tell us about yourself, where you're joining us. We will be recording the call, and we will soon post it on our YouTube channel. The Teams has the closed caption option. You can open the closed caption as I speak, and you can see that in English or any language of your choice. You just have to select the language in the setting. As I mentioned, please raise your hand if you have a question, or use the chat, and keep your mic and cameras off for now. I am your moderator, Baggashi. I'm the founder, managing director, and CEO of B.I.G Consulting, and I'm very, very happy to have you here today. I know many of you are asking about your certificates of attendance. As we promised you individually and in the previous call, certificate of attendance is ready, and we will send it to you individually via email, and we thank you all in advance. As a token of, let's say, if you appreciated the calls and the webinars, please make sure you repost them on LinkedIn and share it with your colleagues, and encourage them to join us in season 2. Season 2 will be hopefully, inshallah, after Ramadan, when we all come back to, let's say, normalcy after the Eid holidays. Thank you again, Dr. Ahmed Baggashi. Without your support, your supervision, your guidance, and your strategic vision, we would not be here. I can see that after the agreement with B.I.G, there are also other companies and other technology companies who are joining us and joining you to educate the team and the members, and we are very, very happy about that. Dr. Ahmed, is there anything else you would like to add?
No, I just want to say thank you so much, and we wish that we will continue this, cooperation for education and training for a long time, and we hope also to mix more speakers, more experts, people from different countries. That's all, and thank you so much. Also, special thanks to Nancy, my friend, and wherever I go, I can hear her name. If they speak or discuss about reprocessing flexible scope, Nancy name will be there. Thank you so much, Nancy. Thank you.
Yes. And as I mentioned to you, today we are very pleased to have Ms. Nancy Steenbakkers, CEO and founder of Ultrazonic, with us. She really knows what she's doing, and she really knows what she's talking about when it comes to ultrasonic cleanings and endoscopes. And I will just share the screen and pass the mic to her. Again, Nancy, a big, big thank you for joining us in the middle of your holidays. I know it is not easy, but we really appreciate it. Thank you very much.
Okay, thank you, Babak, for this very, very long and nice introduction. And I also want to thank Dr. Baggashi for the support, because it's so important. The more education that we can put actually in the world, the better our patients will be in a safe area and a safe examinations. So actually, it's so important to take care about the cleaning of endoscopes or cleaning of surgical instruments. So we cannot deny that. So so I'm going to talk about revolutionary and unmistakably endoscopy cleaning, and for sure the unmistakable, the mistakes which is happening in every department of endoscopy is actually massively growing and still staying, actually, because we have a lot of operators are moving out of the hospital, going to another hospital, or don't work anymore in hospitals. Then we have new new staff, and also then they have to get actually the latest technology, the latest knowledge to be sure that endoscopes can be cleaned in a good way. So Babak, you can go for the next slide, please. Yeah, so who am I? Actually, I'm just Nancy Steenbakkers. I'm born in Belgium, and I was working 20 years as a nurse in operating theater. That moment I was always working in dental field, so maxillofacial surgery in the mouth, and also there we had a lot of complex situations that instruments were not clean enough, but we had these discussions that the instruments were sterile. But anyway, we don't have to doubt anymore about the sterility of an instrument as long as it's not clean. So please go for the next. Now, going for an endoscopy, this is actually a very old advertising, but going for an endoscopy at the moment is just like visiting a casino to play roulette. And it's the Russian roulette, because you never know on the inside, because it looks black, there's a black hose, and inside there are 5 or 6 channels. And you never know that all the channels get actually the right attention to clean it. So most of the time there is always a time issue, and there's also sometimes some conflicts with the water quality. Sometimes you don't have the time to respect the contact time of your detergent, but this is all influencing actually the cleaning efficacy of your endoscope. So please put on the next one. So the cleaning approach for endoscopes, is it possible during pre-cleaning? And yes, we can do that. But then we have to go more and more for reprocessing, and reprocessing actually in an automated situation. Please go ahead next. Yeah, I have to click on it. So actually, when you should go in Google and look after nosocomial infections, you have millions of reports at the moment, and it's still growing. So actually, if you click on that, even today we have 11 February 2025, and there is another one. If you click on it, Babak, and there you see it again. What is the scope of endoscopy risk? Now it's 13 February 2025. But so if you click on it again, so you really have this, it's 2025, and you have the more and more conflicts with clean endoscopes. We find actually very easily all kind of infection issues with the endoscopes. But of course, the patients, they will not get right away to have an actual infection. The infection will appear maybe after 4 or 5 weeks. And it's not always actually aligned actually on the infection is not always aligned actually on the endoscopy examination. So this is something that we have to take care about. Take care for the next, please. Oh, yeah, this is the last one. It was actually in Germany, because all people in Middle East and out of Europe, they really think, and we're trying really in Europe to do our very best to avoid actually all kind of Klebsiella and very heavy duty bacteria, but it's still happening. So also this latest report was actually a few months ago in the German hospital. Yes, please. Now, of course, as long as we cannot clean, you will never have actually a very safe endoscope. So that's what you can see actually in all kind of regulations, all kind of manuals. It's always mentioned actually to clean and to clean and to clean actually your endoscope. So the high level disinfection, this is in a later stadium, but the first thing is actually you have to clean it right after the examination with the bedside cleaning, and then it goes actually in a pre-cleaning in a sink, and there you have to do a lot of steps, and sometimes it happens, and it happens very often even, that the steps are not always followed up. So please for the next. Now, I don't have to tell you, this is okay. I don't have to tell you that the types of endoscopes, there are many. Of course, you have it for the kidney diseases, you have it for lungs, for colons, for stomachs, and so on. So you have all kind of different endoscopes, and they all have their specific cleaning, the need of cleaning, and it has to be efficient, the cleaning. But of course, as I told you, it's black on the outside, so you cannot see it actually on the inside what's happening. Can you go for the next? And even when you have endoscopes without any channel, you also have to pass a leak test. And this is something that I really get headache when I'm visiting hospitals to the ENT department, the bronchoscopy department. I see very often when there is no channel that the endoscope gets just wiped off with some detergent or some disinfectants and will be hanged just on the side for the next patient. But you have to pass a leak test. You cannot avoid any instructions for use from your supplier. So when it's Olympus, you have to follow the instructions for use from Olympus. So it's really strange that I see for those specific endoscopes that the instructions for use are not always followed up. And this is really something that you may go for the next, please. Okay. Now, this one is not something that I made myself. This is made by Dr. Michelle Alpha from Canada. She actually was testing the bacterial load after examination with an endoscope. So she was actually taking samples of the channels and testing actually what is the bacterial load in every single endoscope. Of course, she was now making actually a schedule about that. But if you see the bacterial load after bedside cleaning, what do I mean with bedside cleaning? This is actually the cleaning right next to the patient when the endoscope gets out of the body. There you have to flush. You have to flush and you have to respect some steps that you're really doing the bedside cleaning in a good way. In some hospitals, they are using only water. In others, they're using water and detergent. And in others, they just have these kind of bags with the liquid in it, and they can just start all over again with the bedside cleaning. So this is actually something that you can do, but it's not traced. You don't know if it's done in a good way or not. Then if you go in the middle, there you have a result of the potential bacterial load after cleaning. So that means you go to the sink, you perform actually your bedside leak test, then you have to rinse and flush all the channels, then you have to brush, and then you have to flush again. This is actually the whole procedure. But sometimes we see in some endoscopy departments, they don't have the time. The patients there is actually some emergencies with patients. They cannot respect all these steps. And then you see actually two different results. So the red result is actually the one that's actually your missing steps for sure. If you do it in a good way, then you have the gray bar, and that's actually really a better result. But here she wanted to improve that when you put the gray bar then as a result in the washer disinfector, it will not minimize the bacterial load anymore. So that means that the full focus has to be in the cleaning. So the pre-cleaning in your sink is a most important step of the whole procedure of your endoscope. This is something that you really have to understand, because a lot of people, they're really relying actually on the washer disinfector, and because it's a disinfection cycle, but the cleaning cycle in a washer disinfector is way too short to do it all in a good way. That's why Dr. Michelle Alpha, she found it out that the washer disinfector has their limits. That's why she says you have to go more and more to the manual pre-cleaning in a good way. Next time, please. So here you can see also the full cycle of an endoscopy reprocessing. So you have the contamination, you have the preliminary cleaning, then you have the transport and safety, because it has to be covered. You have to see if it's contaminated or if it's clean, and then you have the leak test. And the manual cleaning, and those two steps. So number 4 and 5. If you click on the slide again, then you can see actually these are the only two. The only two steps which is not automated. When you go to intermediate rinsing, the disinfection, the final rinsing, the drying, it's more and more actually that you see hospitals are investing in drying cabinets, in washer disinfectors, and so on. So, but the leak test and manual cleaning is still humble in the whole endoscopy reprocessing. Next slide, please. As I told you, you have all these magnificent washer disinfectors, and they're all good, you know, but at the end, this is not a magic box. So that's something that you have to understand. You cannot deny the manual pre-cleaning steps in your sink to go straight into the washer disinfectant because your result gets the more and more worse. So you cannot do that. You have to do it in the pre-cleaning. And you have to follow also, of course, the instructions for use from Olympus, Pentax, Fujifilm, Wolf, Storz, whatever you have. So here again, you have the washer disinfectors with two sides. You have the dirty side and you have the pass-through device. But also they are very magnificent good, but still they are not a magic box. They're still, when we were testing those devices, it's a good device, but of course we still have to count first on a good pre-cleaning. Next, please. Hello, next, please. Not working? Oh, yeah. Now, what we see also in every hospital is repair. Repair cost is massively growing in every single hospital. Now, this is just a regional hospital in Belgium. In 2015, they had a repair cost of 90,000 euro. And today I just visited them again, and now the repair cost is about 140,000 euro. And this is also because a part of it, it's not always, but the part of it is actually because of mishandling of the endoscope in your manual sink. In your manual sink, you can do a lot of damages, and you have to be aware about that. So you also see that some hospitals are suffering about repairs. Even here, the Olympus is just showing actually that they were investing actually a lot of money to have a new facility in Portugal, and they are hiring 300 employees to repair endoscopes from European hospitals, I can imagine, or even maybe regional hospitals. But you see, actually, the business from Olympus is not only selling the endoscope; it is also the repair of endoscopes. This gives them a good return. So this is why I wanted to show you this slide, because I want that you understand what is happening in repair in the repair world. Okay, next slide, please. So as I told you, the instructions for use from Olympus, Pentax, Fujifilm, Storz, whatever you each brand, they have their IFUs, but with Olympus or in all those endoscopy repair, companies, they are mentioning actually the pre-cleaning not in a good way. They are missing also some steps because they were not aware how tough a bacteria can be, because we have the more and more antibiotic resistance bacteria, and so bacteria get more and more resistant to any treatment. So that's why we have to be aware that the IFUs from Olympus or other brands has to be lift up. Next, please. Now, then if you go to the European Society of Gastroenterology, endoscopy nurses, they were also having a webinar, what can go wrong when pre-processing flexible endoscopes. And it was really a big, actually there were big issues that they wanted to discuss. And I want to show you actually some slides of them. Next, please. So you have the duodenoscope. This is one of the most difficult endoscope that you can clean. And for sure, also when you have this elevator channel, this is still giving some headaches in many hospitals. Even when you don't take care about your biofilm bioburden, if you click on the slide, please, then you have actually this kind of situation. So if you see that there is some kind of color on your endoscope, in your endoscope, some tips where you can see barely actually that there is a brown color appearing or something, that means your biofilm is starting to grow. So you have to take care about very, very precise to clean the endoscope in a better way. Next, please. Now, understanding of hygiene in examination room is also an issue, of course. So if you go for the down on the left side down, there is actually a sterile field to do the examination with the patient, but they let their cell phone on the sterile field. So this is a big professional mistake. Above there, you have actually they're even eating in the examination room. It's not allowed. you really get actually also the bacteria by yourself. So you have to take care of it. And then downside, on the right side, there you see actually this kind of stuff that they are using. Inside, if you should zoom inside, you see actually in the tube, there is all kind of biofilm growing. So also there you have to take care about what is the situation on your endoscopy tower. Next slide, please. And then, of course, if you have a sink and you fill it up with water and maybe some detergent, it happens many times that all kind of items of endoscopes get in the sink and are waiting actually for an operator to do actually the cleaning in a good way. But you can understand if you have that kind of situation, it's very hard to succeed a good cleaning. Next, please. Even here, when you have this minimized squared sinks, an endoscope is long, it has their own curves and it has their own flexibility, but if you really manipulate it in a wrong way, then you're damaging it again. So you, to be honest, you cannot clean any flexible endoscope in such a little sink. It's really very difficult to perform it in a good way without damaging the endoscope. Next, please. So that's what I want to show you. This is really from the endoscopy nurses from Europe. They also showing actually these pictures because leak testing at the moment is always performed in the wrong way, because you have your leak test pump and Olympus, for example, or even also Pentax, they are mentioning you have to drown actually the endoscope in the water to perform the leak test. This is totally wrong, because then you get those kind of situations. So you have to perform your leak test in a dry way for 2 minutes before you soak it underwater, and then you will not have this kind of situations. So you really can avoid all kind of repair costs if you do it in the right way. Next, please. Here is another example that actually, because of not doing the leak test in a good way, you have really creating actually all kind of damages in your endoscope. Next, please. This is another one. Next, please. Yeah, there's all kind of little pictures that I put actually in this information. Here also, you know, on the left side, you still see there is a stent in the channel. And I heard now that some manufacturers of leak pumps or pre-cleaning, they are now mentioning you can clean it just with the pump with water and air, and there is no need to use any detergent anymore, and no brushing is actually mandatory. But I can assure you, a stent in a channel, if you're not brushing it in a good way, your stent will stay there. So the next patient, when you're doing actually a biopsy actually with the next patient, and you go with the needle through the biopsy channel, this patient will get this stent in his body. I think you don't want to have these kind of situations in your own endoscopy department. So in the other pictures is also the same, that you see corrosion is appearing very easily. Next, please. And then here you can see also that if you really have a small and a tiny sink and you have to brush, you're really easily breaking actually the cable, because of course you have to do it you have to brush, but if you're handling and the corner is actually too tight, then you're really breaking the cable again. So this is also a high cost of repair. Next, please. I don't know what happens, but there is nothing moving. Yeah. So also you have to check also your lenses. What is the condition of your lens? Are they really in a dirty way? So sometimes I heard from doctors, they say, I don't have a clear view anymore. That means one of the reasons can be that your lens is actually full of biofilm, bioburden, and of course then you cannot see it very good. Some parts are even missing actually to keep actually the lens on the right side, because when the parts are missing, human debris get also inside the endoscope. And also when it's damaged, you have to repair it, because when there's something wrong with your endoscope, you're really creating very easily cross-contamination from one patient to another patient. Next, please. And then, of course, please follow the IFUs of your detergent. Don't try to find out another detergent, even when it's not available in the market. Don't go for chloride products, because this is really very harmful for your endoscope. Next, please. And then also the discussion how to sample an endoscope is also something very attractive, let's say. Most of the time I get actually the information, yeah, we do sampling, we put actually sterile water through the biopsy channel, then we collect the water and bring it to the laboratory. It can actually be a good sign, and it's a good start, but this is not in the correct way. You really have to sample all your channels. And Validos from the Netherlands, they have now this kind of sampling kit for flexible endoscopes, and you can just manage it by yourself. You don't have to get actually any assistance to do it in a good way. You can just put your endoscope in this tray, you connect it all the channels, you have the sterile water bottle, and you just go step by step. You go for you connect and open the next every channel to actually take the sterile water through the channel, collect it, and then put it in the pot and bring it to many different pots, of course, and then you bring it actually to the laboratory. The next slide will be a movie, and I remember from last time that movies are very hard to show it now. So let's give it a try. If not, then you can see it later on the YouTube channel. Yeah, it's yeah, you can see actually here is the kind of introduction when the endoscopes are getting in the washer disinfector. But after the washer disinfector, you can sample your endoscopes, but you can also do it, the sampling, after your pre-cleaning with your sink. And in my idea, it should be good that you do it once a week or once a month to see if your pre-cleaning is still in a stable condition or not. So here you can see actually there's also some valves in it. The valves are sterile packed with the device, with the sampling kit. So it's very easy and very safe actually to get actually a sampling of your endoscope. And if you do it in that way, then you really have the full overview. What is happening with my endoscope? What is the condition of my endoscope? The moment that you see any bacteria, then you have to take care of your procedure. Okay? So next slide, please. Now, biofilm, this is something that we cannot deny in endoscopy. Biofilm is very easy to grow, actually, because an endoscope on the inside is black, it's dark, it's humid, and it's warm. So I don't have to express you that how biofilm is growing. It's starting from the first second till you're going to clean it. So that's why your cleaning procedure have to tackle this biofilm immediately. And if you're missing some steps in the pre-cleaning in your sink, then your biofilm is still growing and growing and growing. Next, please. Taking care of biofilm is actually, there are some products in the market, and most of them, it has to be an enzymatic one, because the enzymes are really destroying the biofilm, and then you can rinse it off very easily. But there is difference between enzymes and enzymes. So the enzymatic that we were creating now together with Medalcan from Greece, they made actually a mix that you're really destroying your biofilm in 3 minutes. All other products in the market is actually, you have to take care about 10 minutes of contact time. You have to respect those 10 full minutes, and you don't have that time. So that's why we were creating actually this kind of 3 enzymatic detergent, where it's proven that you kill the biofilm in 3 minutes. And this is really very handy when you're doing actually the cleaning in your endoscope. You don't waste too much time to succeed actually a good cleaning efficacy. Next, please. Oh yeah, then of course, if you really have the biofilm is there, then you have the Nosozyme 6+. And this Nosozyme 6+ is with 7 enzymes. And you can kill the biofilm when it's really very tough biofilm and you cannot succeed anymore with your original detergent. Then you can use this kind of detergent, and you can put it actually in a tray with water, and you respect about 10 or 15 minutes, and your biofilm, which is really sticky on your endoscope, will be gone. So this is also very helpful for you. Next, please. Yeah, then we have the Nosoprotect. Nosoprotect is a disinfectant, and we are using this disinfectant to disinfect the full device that we were creating. We are not disinfecting the endoscope because it's not allowed, because our device is a class 1 device. It's not a class 2B device. So, but we had to, with the notified body, they came to us and they say, you have to disinfect also your sink. You have to disinfect the drain. And the drain, I can tell you, you cannot believe how dirty your drain is. So if you're using your sink and you think, okay, it's all shiny, well, go and take a sample of your drain. You will be really surprised how dirty your drain is. And it's also very dangerous to work with a very dirty drain, because you have all these aerosols will appearing actually in your endoscopy department, and you can really infect a lot of people. Next, please. Now, redesign your endoscopy sink. There are many sinks at the moment, of course, in the world. You have the square sinks, you have the long sinks. But those sinks, it's only stainless steel, and stainless steel is not bad, of course not. But the most advanced system we have is actually the height adjustable sink. So you really have this possibility to put it on your height for ergonomic situations, which is good, of course. But the most the most important things that has to be on the sink is a good leak tester that really can perform the leak test and give you a sign and some information what is happening with your endoscope during the leak test. And then, of course, you also need a very good kind of pump to clean all the channels before brushing. And this is also something that we see a lot in endoscopy departments. We forget to flush all the channels before the brushing. And this is so important. Next, please. I don't think it's a question. So, as I told you, there are many sinks in the world, and this is on the left side. This is in Singapore. They have 5 sinks, so they need 5 operators. On the right side, this is in Ireland, height adjustable. You see all these little manipulations actually to the high level, the height adjustable. But at the end, there is no control. There is no traceability. You don't have any clue what's happening with your endoscope in the sink. So you, as a manager, it's very hard to control all these very important steps. Here again, this is in Denmark. So they have all these magnificent washer disinfectors from Olympus and the drying cabinets of Olympus. It was an investment of 1.8 million euro, and they only had 1 operator. So they had sinks, what was also delivered by Olympus. Next slide. So, but this sink is not smart at all. So you can see on the left side, there is the leak tester. They prepared the bottle with some water and detergent to connect it with the channels. And in the real time, they were filling up the sink at 8 o'clock in the morning, and at 1 p.m. they were still using the same water. So you cannot clean any endoscope when you're not refreshing your water and your detergent. This is clear as normal. You know, you don't want to take a bath when 10 people before you are getting in the bath, and then you have to try to clean yourself in a bath. This is the same with an endoscope, and the And with an endoscope, you have more bacteria and more difficulties than just getting a bath while your family was getting sitting in the same water. So, but this is really an issue, and all the other devices that they had for pre-cleaning, they were just using it as a stock room. So you see, actually, when there are not enough operators, hospitals are investing in a total different way, and even in a wrong way, because they're investing in sinks, and the sinks will not be used even. Next slide, please. Yeah, here also an example. This was all in the same hospital in Denmark. So this gives me a lot of pain, because I know that this lady who was working in that hospital was doing her very best, but she could not do that because there was too short in staff and too much a quantity of endoscopes. So this is really, she was really working very hard, but could not succeed in a good way, the pre-cleaning. Next, please. Now here again, this also it's a kind in somewhere in Amsterdam, I think. So they have 3 pre-cleaning sinks, which is always already very, very nice. But there is a traceability. They have actually a monitor in front, but all the steps of the traceability are not followed up during the manual cleaning. So this is also something which is not yeah, it's a big investment, but there are still some gaps appearing in the cleaning efficacy. Next, please. Yeah, so that's what I told you. This is traceability. This man was in Ireland. He showed me how to pre-clean an endoscope. So you see the endoscope on the right side, and he was filling up the sink with water and detergent. At the same time, he was talking and laughing with his colleagues, which is really enjoyable. And next slide. Yeah, we're talking about traceability. So here also, I want to show you the need of traceability. So then he was soaking the endoscope right away underwater. He was not performing any leak test. And he was soaking it underwater till you see the blue marker there. That is the water line. So he just was filling the sink with water and detergents and waiting till he was achieving the water line. Next, please. Then he was not even flushing any channel. He took actually the endoscope head on the edge, and then he started brushing. I can tell you this is not how it should be. Please don't do it ever. But with this example, I wanted to show you also the need of traceability in the manual or in the pre-cleaning in the sink is so needed, because many people are doing some mistakes. Not because they want to do mistakes, but it's just because they are short in time, they have too much quantity of endoscopes, they only have one sink or whatever. It all kind of situations are happening. Next, please. Now, the pre-cleaning steps to respect is actually this, and don't forget, this is really the only 4 steps you have to do. So leak testing in a dry condition for 2 minutes during on 200 millibar. You have to do it dry. Why? Because the last 30 seconds of those 2 minutes, you will find out the tiny leakages, and it's the tiny leakages which is giving the headaches in endoscopy departments. Then you have to rinse all the channels. If you forget to rinse one channel with water and detergent, you will not clean and you will not destroy any biofilm. And after the rinsing of all the channels, then you have to brush, and then you have the after rinsing. So here, this is just an example of how we see that the people are doing it in endoscopy departments. So they do it or on the right side manually, which is very good in a dry way. But of course, you have to use one operator to perform the leak test, and in the same time they cannot do anything else. On the left side, you have this Olympus pump, which is a good pump, but it's not that smart enough to give actually an idea if there is a leakage or not, because there is no sign on it. So you really have to soak it underwater to see visually if there is a leakage or not. So I try to avoid all kind of human actions to avoid all these kind of mistakes. So the thing is, actually, you have to ask yourself, are we performing the leak test now, dry or wet? What is the pressure that we are respecting? How long are we performing the leak test? Are we detecting actually the tiny leakages? And how are we controlling and tracing the results? Next, please. So these are all kind of leak testers in the market, and they also announced that you have to perform the leak test in a dry condition. Next, please. And of course, you have to perform the channel rinsing with chemistry. So you have to respect the water temperature, because your detergent needs a specific water temperature. And you have to respect the contact time of your detergent. If you don't respect those two important steps, your endoscope is never getting off the biofilm. So this is most important that you have to understand. Control your water temperature, put your detergent in it, and respect the contact time of your detergent. Otherwise, cleaning is not happening. That's clear as it. Next, please. This is also an example. This is in Sweden. They have this sink, they have a pump, and next slide. They are putting actually some water and detergent in this little tray, let's say, and they're putting the soaking channel from the pump in the bucket, and then they connect all the channels with one connector. So, of course, if you leave your bucket for 1 hour like that, your water temperature is gone, and your contact time of your detergent, you can still monitor it actually with the timer, with the pump, which should be good. But of course, if your water temperature is gone, you're not cleaning in a good way. Next, please. Then also some people, they are using actually pistols or guns to flush all the channels, and there are also hidden issues with those guns. On the left side, you see actually the aluminum pistol. You can never clean it, and if you should open it and take some samples of the growth of bacteria in that pistol is unbelievable high. You have to understand, if your endoscope is clean and disinfected and you want to dry the channels with the air pistol, and your air pistol is never having any cleaning or disinfection, your air pistol will contaminate your endoscope again. So this is something that I want to give you as an awareness. On the right side, this is a stainless steel pistol. This pistol you can disinfect, you can put it in the sterilizer, and of course it's a little bit more expensive, this pistol, but it's so resistant for the rest of your life, even, because you can change little parts. When there some parts are broken, you can change it just very easily, and at the same time you're sure that your water pistol or your air pistol will be in the perfect condition to avoid any cross-contamination with your endoscope. Next, please. So that's what you can see here. Sometimes you need actually to use demineralized water or reverse osmotic water. You cannot use that actually with an aluminum pistol. You really have to take care about the material and the stainless steel of 1.4404. This is really very resistant for all kinds of different water qualities. Next, please. Now, the brush procedure, this is actually another challenge because the type of your endoscope, or the type of your brush, I mean, will depending actually your brushing cycle. I'm very big fan of the pull-through, which is made in New Zealand. The pull-through, they have all kind of reports that the pull-through is just one passing with the pull-through and your endoscopes are clean. But of course, you have to flush, and you have to flush it before you brush. It's with every brush you have to do that. When you have a brush with bristles, actually here you can see actually that the here you can see if you're going with the brush through a dry channel, you're not cleaning in a good way. Of course, when you make your channels wet with water and detergent, your result is much better. Okay, this is proven by the University of Southampton in the UK. Next, please. So now I want to present actually our device. So it's an ultrasonic device which is automated pre-cleaning, and there you will not make any mistakes anymore. You can click on entering. So this is really the perfection for endoscopy pre-cleaning. So what we have with this device is we have two long sinks. We have the connectors to connect all the endoscope channels. You have a scanner to trace the operator, the patient, the doctor, and the endoscope. You have also a built-in camera, because with the built-in camera, we will make a little movie about the brushing cycle. So it means when there is a patient had any contamination or get any infection, with this device, you can recall all your pre-cleaning steps while you don't have it now with your sink, what you're using. Next, please. Oh, yeah, there's also height adjustable. So our references at the moment are growing, and I'm very happy for that, because the 10 years ago, we didn't have any demand for pre-cleaning, because everybody was very, very surprised that I was taking care about pre-cleaning. They say, why should we do that? Because we have the washer disinfectors. But that time, I saw that the washer disinfectors were really missing some efficacy. So that's why I started actually together with my husband to build a new device which can tackle all these things. So next, please. This is how the device works. I hope that the movie will work also, that because it's because of the speed. So please try it again, Babak, if it's working or not about this device. It's an explanation how it works. So here you can see actually the lower is going down in the water, because during the leak test, the sink was filling up with water and detergent. So here you can see in the screen that we are doing the flush, and you can also see all the steps that we've done already is also mentioned on the screen. So brushing is just click on that button, it goes up, and there you can see in front of the camera, the endoscope will be brushed. And this is an image that you saw. This is the image. You can see it also in the screen here. This is the image that you see while you're performing the brush cycle. And with this device, you never have any conflicts anymore or discussion if it's done in a good way or not. This device is really following up all the steps, what you have to do. So after the brushing, you have this rinse session again. You still see actually the water temperature on the screen. So we have everything under control. When the endoscope, the procedure is done, then it will be lift up, up, and then the water is leaving the sink to refresh actually the next for the next endoscope. You can never forget and make this mistake to forget to leave to drain actually your water out of the sink. So now you just disconnect actually the endoscope and you put it in the washer disinfector for high level disinfection. But if there should be a problem with your patients, you can recall all these steps and find it very easily in the computer, or it can also be transmitted in the hospital information system. So here you can see some examples. This is one of the biggest centers that we were installing our device. So on the left side, you see the pre-cleaning sinks. They have 2 sinks, 2 devices of us. They have 4 sinks in total, and they only need 1 operator. So we are really having issues in Europe to find good staff to do the job in a good way. So with these devices, you'd only need 1 operator, and you have the full control of each cycle. And on the right side, you see the washer disinfectors. These are the pass-through washer disinfectors from the Steris in this case. And then this little picture there, you see actually the drying cabinets from Steris. Next, please. So the features about this endoscopy department, they have 2 devices, 4 sinks, only 1 operator, and they have the full and controlled cycle in 7 minutes. I give it as a challenge to you. Try to get actually a clean endoscope in 7 minutes. It's very, very hard to do it all in manually things. And then with these 2 devices, you can perform 4 endoscopes in 10 minutes, and you have 100% traceability. This is how the future would look like. Next, please. This is another hospital, very regional hospital. They have the pass-through devices also from Steris. This is the I don't know the name anymore. The Rapid Air. Yes, this is the Rapid Air washer disinfector, and they are using a device from us as an island. So they're working actually with 2 operators because the Rapid Air is a very rapid disinfector. So they need a lot of hands to follow up and to put actually endoscopes in a quick way in the washer disinfector. Next slide. Yeah, this is another view from the same hospital. Here you can see actually how clean a dirty area can be. Okay, so everything is under control. Next, please. And this is in King Fahd Medical City in Riyadh. Now it's already 4 years they're using it. In the first way, we had some difficulties to deliver the detergents and the disinfectants for the devices and for the endoscopes. But now everything is cleared up. We have the Saudi FDA, and all the products are registered. So now there is no interruption anymore in the delivery of the detergents. So this is also something that we take care about. The moment that we deliver and install 1 device in a Middle East hospital, we take care that all deliveries will be smoothly going for the next 10 years. Okay, next, please. So the extra safety features what we have here is because of this notified body that we got. So we have to clean and to avoid actually the growth of biofilm in the device, so in the sink. And this is actually also with these little bottles, it's with the traceability. And the machine will give you an announcement the moment that you have to do actually the biofilm removal program, or when the program of disinfection has to be done. The machine is that smart, will give you a sign that you have to do it. Next, please. Yeah, also again with these detergents that we are using. So the 3 enzymatic detergent to clean endoscopes. And then when you click again on the slide, then you have this Nozozyme 6+. We are using this to kill all the biofilm in the tubes, the channels, the channel connections. And then we have also the disinfection to, if you click again, you have done the disinfection, the disinfectant to disinfect actually your drain and all the difficulties where you cannot clean your sinks manually. Next, please. Can you click again? Nothing is happening, Babak. Hello, Babak, is it working? Yeah, okay. So you have actually with this device a return on investment in 9 months in Europe. Maybe in the Middle East a little bit longer, depend actually of the salary, what you're paying actually your staff. But in any case, you need less staff, so the hospital is winning about that. You have the full control on each cleaning step. You have the control on the brushing by the camera. And this is also something that we got actually as a reaction of some answers from our users. They say we have 80% less damage of endoscopes. So you can imagine that your sink, your square sink, is really getting an historical device because if you have a long sink, your endoscope is more relaxed And of course, we have this layer will bring up and down the endoscope, so you don't have any frictions anymore with your endoscope. And this is one of the reasons that you have a lot of really, really less damage of your endoscopes. We assure 100% patient safety, because that's every patient is what the patient deserves, is safety in any circumstances. The device is built up in a stainless steel frame, but we are using Hymax. And Hymax, this is the white material that you see, and it has the LGA certification, which means that there is no bacteria or virus can grow in the tissue because it's so tight. And this is proven with the certificate. And then, of course, we have hardware, software, and track and trace in one device. So you don't have to buy a sync, you don't have to buy extra software, you don't have to buy extra track and trace. This is all in one device. And it's an open SQL data system, which means that you can connect very easily with the track and trace or with any computer program you have already in your hospital. So it's very easy to connect it. And with this device, of course, we assure you that you have 100% control on human errors. Next, please. We have also, of course, a clinical study, although there is no need for, of course, there was a need of clinical study, but in the pre-cleaning, it never happened before. So we did actually a clinical study in a hospital during 5 years. They had some contaminated endoscopes before they were using our device. But still, since they are using our device, they have 0% contaminated endoscopes. And this is really an amazing result that we were achieving. So I hope that the more and more hospitals are taking care about the effectiveness of the cleaning of their endoscopes. Next, please. So I would like to thank you for your attention, and I hope that you understand what I mean with this. But pre-cleaning in an automated situation is really the future for every endoscopy department. Are there some questions? And I would like to thank you for your attention again.
So Nancy, you have done a fantastic job, and I believe you have done a fantastic job, and the device that you have created is kind of addressing all the problems that you carefully described in the endoscope cleaning and endoscope pre-cleaning world.
Yes, that's exactly right. So I hope that everybody understands a bit. And
Yes.
I know also when there is something new, innovation, it gives a lot of questions. So you're very welcome. If you have some questions, you can ask or you can write down, and I will answer it as soon as possible, of course.
Yeah. No, I think your presentation is very, very detailed. I think you addressed many aspects, and I believe all of our colleagues are now thinking about, okay, what type of endoscope, how do we clean it, how do we pre-clean it, and there's maybe some soul searching and reflection. Of course, we have recorded the session. The videos, they work perfectly from our side. I don't know if there was something with the bandwidth there. But let's see, are there any other questions from the attendees for Nancy tonight? Everybody's very quiet. Okay, so don't worry, you have our emails, and you can always write to us if you have any questions, and we will be more than happy to answer you. You will get your certificates in the coming weeks. We will send them, and as we promised, we will come back with the next season of webinars from B.I.G. And yeah, we will keep in touch. Again, thanks, Nancy. We appreciate it, and see you all soon. Thank you.
Thank you. Thank you. Have a good evening. Bye-bye.
Bye.
Thank you. Bye.